Hello, my name is Dr. Edmond Eddie Osage. I am a gynecologist. I am a specialist in reproductive medicine and surgery. I'm here to talk to you today about endometriosis. Endometriosis is a real passion of mine, and it's a condition that very little is known about, not just within the lay community, but also within the medical community. And we're really trying to get the message out there for people to get to know what endometriosis is, because it's one of those conditions that causes profound impacts on women's quality of life, impacts on fertility, impacts on marriages, and there are loads of things we can do to help women who are suffering with endometriosis. Endometriosis is probably the most common cause of pelvic pain in the world today, and a lot of women lose very many useful work hours and hours they could spend usefully building up their families and themselves because they're completely moribund with pain. We do not know what causes endometriosis. We think there's a genetic predisposition, and that people who are genetically predisposed will have an alteration of their immune system, and that allows endometriosis to develop. And the pathology behind endometriosis is the lining of the womb that women shed when they have periods every month can find their way into the pelvic organs, attached to the lining of the pelvis, attached to the organs in the pelvis. And those tissues can bleed every month when women are having periods. And that repeated cycle of bleeding leads to inflammation, leads to pain, and ultimately can lead to the damage that endometriosis causes, including things like adhesions and blockages of tubes, blockages of other organs. About 1 in 10 women have endometriosis worldwide, and we do know that it can run in families because of the genetic predisposition. So if a mother or a sister has endometriosis, then other females within that family are 8-fold more likely to have endometriosis. The commonest symptom of endometriosis is pelvic pain. So any woman who suffers from pelvic pain, particularly very painful periods to the point where they begin to stop them fulfilling their normal functions like going to school, going to work, should seek help because that isn't normal. Another symptom of endometriosis is pain outside of periods. So women who have pain in the pelvis outside of the period, sometimes mid-cycle pain around the time of ovulation, that's a typical symptom of endometriosis as well. Women need to be aware of. Another classic symptom of endometriosis is pain during intercourse. So what we say is that any woman who has pain repeatedly during intercourse should consider that that's not normal. If women have pain repeatedly during intercourse, then they need to seek help to find out if they do have endometriosis, because that can be a very early sign of endometriosis. One of the biggest problems with endometriosis is that a lot of the symptoms that you get from endometriosis, like painful periods, pelvic pain, pain during sex, women just assume that these are run-of-the-mill life causes that they don't need to do anything about, and that is the issue. So that a lot of women live with those symptoms, and meantime, the endometriosis is growing and getting worse. So we do find that a lot of the time when women actually come to us before we make that diagnosis of endometriosis, they would have had the condition for an average of maybe 8 to 10 years. And a lot of them are at advanced stages when the condition is more difficult to treat and would have probably resulted in a greater degree of damage to women's pelvic organs. So the message is, any woman who suffers from these conditions that I've highlighted today should ask herself the question if she has endometriosis, and should seek specialist help. Any specialist gynecologist that has an interest in endometriosis will be able to do some simple tests for them, which will include things like examining the woman or a pelvic ultrasound scan. And ultimately, the gold standard way of diagnosing endometriosis is to undertake keyhole surgery called laparoscopy, where we put a camera through the belly button to have a look in the pelvis. And if we confirm the diagnosis of endometriosis, then we can go ahead and treat the endometriosis in that way. And a lot of the treatment is very, very straightforward. It includes cutting away the lesions and removing them in a day case procedure using laparoscopy. Now, endometriosis can be divided into different types of endometriosis depending on the tissues that are affected. The most common type we deal with is what we call the superficial peritoneal endometriosis that affects the lining of the pelvis. But you can also have endometriosis that forms cystic lesions in the ovaries. Those we refer to as endometriomas. We can have endometriosis that infiltrates into the body of the womb, which we call adenomyosis. But you also have what we call deeply infiltrating endometriosis, that endometriosis that infiltrates into the deep tissues between the womb and the rectum behind. And those can also infiltrate into the rectum, infiltrate into the ureters, infiltrate into the bladder. And obviously, the deeper the tissues that are involved, the more complex the treatment for it is. But endometriosis, there's no form of endometriosis that cannot be treated surgically. The important thing is finding out if women have the condition. And the only way to find out is for women who suffer from these symptoms we've talked about to seek specialist help, to get examined, to have a laparoscopy done, and then to discuss ways of treating the endometriosis with their specialists. In addition to surgical treatment, there are hormonal treatments for endometriosis that we utilize sometimes. Because endometriosis is what we call an estrogen-dependent condition, it is fed by the hormones released from the ovaries. Part of the treatment sometimes will involve shutting down the ovaries temporarily to remove those hormones to make the endometriosis inactive. And that can be used sometimes alongside surgery and is a very, very useful way of controlling pain. There are other medical treatments we can use to manage the symptoms of endometriosis, like the combined oral contraceptive pill, or the progesterone pill, or even the Mirena coil. And all of those, because of the hormones they contain, can also reduce the inflammation from endometriosis and reduce pain and improve quality of life of women. Where endometriosis is associated with infertility, although 10% of women have endometriosis in the general population, we find endometriosis in 40% of women who suffer from infertility, which tells us that there is a direct linkage between endometriosis and infertility. For women who suffer with endometriosis and infertility, surgical treatment is the best way of dealing with the condition, because use of hormones in those women will also interfere with their attempts to conceive. So bottom line, women who suffering with severe pain, pelvic pain, period pains, pain during intercourse, who should suspect that they might have endometriosis. The only way they can find out is to go see a specialist, get examined, and undertake some basic investigations that will confirm the diagnosis. Once the diagnosis is confirmed, the treatment is very straightforward if the condition is caught early. But there is treatment for everybody with endometriosis, and my advice is that women should take the opportunity to see a specialist. My name is Dr. Edmund Ediosage again, and I am a specialist gynecologist.